These records reflect my autistic son's dramatic speech improvement over a 3-year period as a result of early intervention and medication. Here is the first test performed on my son when he was 3 years 4 months old by a speech pathologist. When he was 3 years 4 months old, the speech pathologist considered his articulation to be okay. When he was 3 years 4 months old, the speech pathologist put his auditory comprehension in the bottom 1 percentile and his expressive communication in the bottom 1 percentile also. The speech pathologist felt that Ben presented with a severe receptive and expressive language disorder with deficits across all domains of language. The speech pathologist diagnosed my son with a severe receptive and expressive language disorder and recommended speech therapy, a psychological evaluation, and an occupational therapy evaluation. My son failed an initial speech screening and was given a formal evaluation for speech and special ed by the school district about 6 months after the private evaluation. My son fared much better on the school district speech test than on the private speech test. The school district speech test was visually based. It was a different type of test. My son did poorly on several sections of the behavior assessment system for children questionnaire. My son was given a cognitive test and he scored a percentile rank of 4, and he was given a skills test and scored in the 7th percentile. This page basically says that my son, who was 3 years, 9.5 months at that time, was rejected by the school district for services. On this page, the educational diagnostician gives some recommendations for facilitating my son's education. This is the speech report done by the school district when my son was 3 years, 9 months old. We tried to get him services through the school. Most notable about this test was that my son scored in the 13th percentile for expressive communication. I had worked with my son myself since we did not have adequate insurance. This page relates a conversation between the speech pathologist for the school district and my son's preschool teacher and the problems he had in preschool. This page gives a further discussion of some speech issues by the school district speech language pathologist. This page relates the final test results. Again, this test was done by the school district about 6 months after the initial private test and was visually based. This page basically states that my son is denied speech services by the school district. Notable on this test were the picture vocabulary score of 84th percentile, relational vocabulary score of 84th percentile, and oral vocabulary score of 5th percentile. This page reflects that my son needed further help in pragmatic speech and some articulation issues. This is the therapist's signature page. My son did eventually qualify for special ed services, but I did request additional testing by the school district, which was done in January of 2011. According to this page from the AISD records from January 2011, my son did still have some functional speech issues. This page shows which tests were used with my son, and it states that he does show anxiety throughout the day. This page describes some autism testing done by the school district. My son had previously been admitted to special ed based on social skills delay without an actual diagnosis of autism by the school district. This page goes into detail of the autism testing that was done on my son by the school district in January of 2011. This page shows how the school district felt that my son did on the childhood autism rating scale. My son was 6 at the time of this assessment. According to this page, my son, who was 6 at the time, qualified for special ed under the autism classification. Previously, he had been admitted under a different classification. This is the IQ test performed by the school on my son when he was 6. Scores varied widely. Verbal comprehension was 127. Retrieval fluency was 70. Overall IQ was 98. Here the examiner breaks down the results of the IQ test, saying basically that he performed in the average range on most areas. Here, long-term information retrieval was discussed, and it was noted that my son did much better when visual aids were used. There was a big difference on the subtests in this area. On this page, the tester basically noted that my son's adaptive skills were lower than would be expected for his IQ. On this page, some academic issues were discussed, and it stated that my son was eligible for special ed as a result of autism, other health impairment, and speech impairment. This page gives a whole lot of good recommendations from the tester about ways to help my son to learn better in the classroom. This is the signature page for the school district team that evaluated my son in January 2011 to see that if he met the qualifications for autism. This is the last page of the report prepared by the school district regarding my son. This is the report prepared by the neurologist when my son was 3.5. During the initial evaluation with the neurologist when my son was 3.5, he was diagnosed with mild static encephalopathy, manifested as speech and language disorder, and possible coordination disorder. This is the last page of the initial report done on my son by the neurologist when he was 3.5. This is a page signed by the neurologist stating that my son should get special ed services based on his diagnosis, and also stating that my son is going to start on Prozac. Here's a page signed by the child psychiatrist diagnosing my son as having sensory integration disorder. Here is a letter signed by the child psychiatrist from January 2010 saying that my son had PDD. I had a complete auditory test done on my son when he turned 6 in 2010 just to completely rule out any kind of hearing issues. This is the second page of the hearing test, basically saying that my son's hearing was just fine. This is a page about me, the mom. I do have a BA in English, MA work in English, certification to teach English, and a law degree. There are medical issues in the family.